जल्दी करो.
Okay, so hello, Dr. Preetha Ghosh. We will practice breaking bad news here. I have said in the past that bad news is not always cancer, but cancer is always bad news. So in this particular station, Dr. Preetha Ghosh will play the role of the doctor and I will play the role of the patient, a 55-year-old man who was diagnosed with laryngeal cancer 10 years back. He received radiotherapy for it and he has developed hoarseness again. Biopsy indicates recurrence of cancer. There is no metastasis. Now, Dr. Preetha Ghosh has to explain to me what is the further plan of management. So in MRCS ENT OSCE, you don't get the benefit of looking at the question or the time when you are performing the task. So when you're ready, Dr. Preetha Ghosh, I will stop sharing the screen and I will start the timer.
Yes, please.
Please start.
Good evening. I'm Dr. Preetha, one of the ENT doctors in this hospital. Could you please confirm your name and date of birth, please?
Yes, my name is Paul Adams and I am 55 years old.
And how may I address you?
You can call me Paul.
All right, Paul. I understand that we are here to discuss the reports that we have. So are you alone or is someone with you today?
I am alone.
All right. And is it all right if I invite this specialist nurse for this discussion?
Yes, that's perfectly fine.
All right. And I have actually kept away my phone with my assistant so that we are not interrupted during our discussion here that we are about to have. But before we start, I just would like to know what do you already know about your condition?
So I don't know if your records reflect it, but I had cancer a while back for which I received radiotherapy and I believe I was cured because I stopped receiving radiotherapy. But about 2 months back, I developed hoarseness again and I underwent a biopsy a few days back and I'm guessing you have the report with you right now.
Yes, I do have the reports with me right now. And are you comfortable discussing them right now?
Yes.
But before we start, do you have an idea what might be happening or any concern in particular?
Just give it to me straight, doc. I think I have cancer again. Is it true?
I understand your concern. As we having bed cancer once, I know it is really, it might really scare you to hear it again. But unfortunately, the reports that we have here do indicate that your cancer is back. I'm so sorry to tell you this.
I was expecting that. I had told your colleague 10 years back that I wanted the surgery, but he suggested that radiotherapy is the best course of action. Is it because of the radiotherapy?
Well, unfortunately, that is not the case. Well, the treatment options for a patient is decided by in the MDT meeting, and cancer is a disease which is not completely understood, and there is a high chance of recurrence in the first 5 to 10 years. So that could be a cause as to why that has recurred. So let's not focus on why that happened and stop blaming ourselves. But the good part here is that it is still limited to your voice box according to the scans that we have, and it has not spread to any other part of your body.
You see, the last time we had this discussion, I was told the good part of this diagnosis is that it is limited to the voice box and it can be cured completely. But here I am without it being cured completely. And now you're telling me that there is treatment. What is there to believe that this time the treatment will work?
Well, I do understand your concern, and I know you have had cancer once, and having heard that word again is really disheartening. And we'll try our best to help you get better. And cancer is a disease which is still under a lot of research, and it is not fully understood. But is it okay? Would you like me to tell you about the further plan of management that we have for you here?
Again, I think you'll have another cancer MDT meeting.
Yes, we will be having an MDT meeting as a multidisciplinary team, which is held once every week, and they will come up with a plan which is best suited for you. But here the option that we have might be that we might have to, unfortunately, remove the whole of your voice box, as this is a case of recurrence. I'm so sorry to tell you. We might have to keep that consideration into mind.
So I'll not be able to speak.
Yes, unfortunately, you will not be able to speak after the surgery, but we will provide you various devices or various prostheses, and we will set up a meeting with our speech and language therapist who will actually help you after the surgery to communicate.
So these devices, these prostheses, these will help you speak.
Yes, they will actually help you speak. I will arrange a separate meeting where once we come up with the plan of management, and if surgery is the option here where we have to remove the whole of your voice box, then we will have a different discussion there in details as to how and what kind of management will be there. But there is a support group, as you're already aware of. Would you like me to enroll you into that again so that you can actually share and see how people who have recurrence and how they are coping up and how they are doing?
Yes,
That might
please.
help you.
Yes.
All right, fine, I'll do that. And is there anything else that you would like to ask me?
When are you scheduling this surgery?
I'm sorry.
When are you scheduling this surgery?
Well, once we have this MDT meeting and we confirm the plan of treatment, we'll have to do a few tests because it will be a major surgery and an anesthetic checkup. So once we are done with all that, we will schedule a meeting as soon as possible.
Could you tell me about the different methods in which I can use my voice again after the surgery?
Well, I'll just tell you in brief. We will set up a meeting again where we will discuss all this in details. So we might use the prosthesis, which will be attached to the back of the opening that we'll be creating here for you to use after the surgery. You can use that prosthesis. There might be a handheld device which you have to touch to your chin to speak. And then there might be something known as an esophageal voice where we'll train you vigorously to use your gullet.
And could you tell me a little bit about the risks of the surgery?
Well, there are some risks like there could be bleeding, there could be infection, there could be scar formation, and then there could be some kind of closure of this hole that we create. There might be some kind of fissula or opening that might happen. We'll discuss that all in details. Do not worry about that. Let's first get through the MDT meeting. Is that all right?
Yes.
So this is a leaflet which contains all the information here, and here is a number where you can contact us for any further assistance. Is that all right with you?
Yes.
All right. Thank you so much for your time.
Thank you, doctor. Okay, so that is a pretty well negotiated statement. I'll pause, I'll stop the recording here. Well done, Dr. Prisa Ghosh.